All right. Welcome to our webinar today. It's 12 p.m. We will get started. I am Rain, Marketing Manager of Cobalt.io, and I have the pleasure today to have Jeff Onklek, Chairman and CEO of Claris Healthcare, and our very own Peter Skouronis, VCSO of Cobalt.io, to share with us their experience working in and for the healthcare industry, so that you can all learn about how you can build better security posture. Before we begin, I'm just going to go through some of the housekeeping items very quickly. So you will get the recording after this section today. You will get the slides via email. And in the Q&A box, you can feel free to drop your questions there and we'll address them live. So today's section is recorded again. And over to you, Peter.
Thanks, Rain. My name is Peter Skouronis. I'm one of the VCs of Cobalt. My experience is in the IT industry over 20 years. 14 of those has been in cybersecurity. I've worked with many size businesses in the UK, Europe, Canada, US, in various industries. So I had the pleasure to experience different situations, different environments. And in the last 3 years, we've been working with Cobalt, helping small businesses and startups implement information security programs, go through compliance, and build their posture over time. That's me in a nutshell. I'll pass it over to Jeff.
Sure. Yeah, so Jeff Auchinleck, I've been knocking around the medical device development field for the last 40 plus years in the Vancouver area. Most recently, my last couple of companies have been heavily software-based, which opens up the whole can of worm about cybersecurity, HIPAA compliance, and various other things. I guess maybe the story is it's not as hard as you think it is, especially if you get some help from organizations like Cobalt.
Thank you, Jeff. And over to you, Peter and Jeff.
Yeah, I think let's start looking at like what led you to seek SOC 2 HIPAA compliance and get like follow framework in the first place, Jeff.
Yeah, so a little bit of background. The company that I'm currently running is called Claris Healthcare. And we provide a platform for the care of seniors in their own homes. So professional caregivers on the back end may be receiving vital signs information, providing medical advice. We also have a whole suite of entertainment and various other things to keep seniors from feeling socially isolated and lonely. But because we are recognized and named a healthcare company, we have a very high profile for people who are trying to steal information and attack us. For whatever reason, the baddies think that health information is very, very valuable. So we have a big target on our back in terms of people trying to hit us with ransomware or get us to release information. So for that reason, we have always had the challenge of ensuring safety. And I see already in the Q&A box there's a question about HIPAA. HIPAA came out in the last millennium, but it's actually an Insurance Portability Act in the United States. But there's a little hook in the back about privacy and security, which is can be very, very expensive if you make mistakes and release information inappropriately. So that's something else that that we had in mind when we launched Claris and began our development. And a number of things have happened since we started Claris back in 2012. Obviously, the COVID epidemic and the switch over to essentially virtual work completely changed our attack surface in terms of network and security. We do not have a corporate network in a building somewhere with servers spinning and locked doors and things like that. Everything that we do is on the cloud and is virtual. And all of our workers work virtually. And that opens up a whole new range of challenges and concerns. At the end of the day, what we've had to do is design security, cybersecurity into everything we do right from the get-go. And just a few examples. All the data that we collect and save is encrypted both at rest and in transit. That's kind of table stakes. We have specifically designed a structure where personally identifiable information or demographic information is stored completely separately with different security in a different system from all of the health-related data. And there's the only link between the two is an encrypted code that links the actual patient identification to the data. So you'd have to crack both of them essentially to be able to link information to a particular person. We also have very strict policies in our company. If you want to get fired from Claris, just disclose some personal information outside of the need to do it. You're done. One and you're done in terms of any kind of disclosure of protected information. That's made clear the day you sign up with us. You sign a document agreeing to that. Then on top of that, we do what I would say are pretty straightforward things to protect our systems. Obviously, because everyone's working on their own devices at home, we enforce security on their devices. We insist that people use VPNs, they keep their systems updated, they use the company's password manager, and they're being monitored by a Vanta agent to make sure that they're all doing what they're supposed to do. We keep an eye on them. So the trick, I guess, overall is, what we've done is we've designed for cybersecurity right from the beginning. I mean, that was always top of mind at the beginning. And since then we have continued to add on and take on policies and procedures to ensure security. Stop there.
Nope. Sounds good. I think like what you mentioned and like working together, having like senior management involved from the beginning and have that buy-in and accountability across all levels, because what happens, a lot of businesses, they view security or cybersecurity, information security as a function that lives somewhere in the corner of the business, handled by some people. It's the reason that it fails a lot of the times, because they approach it as a technology problem, where it's always a combination of people, process, technology, and the thing that helped that Claris Health move so quickly and progress through SOC 2 is that you had, as you said, a good foundation. You had processes in place. You had separation of duties and a lot of the fundamentals in place. And it helps run the business better. It provides trust to your customers, especially when you have, as you said, elder population and users that don't know how to use technology. So taking care of the back end, making sure everything's secure, also make it accessible and approachable to somebody who's not used to using technology.
Yeah, so I think you hit on one of the key things is that cybersecurity can't be something, and it can't be an afterthought. It can't be something you do, well, we have to do it, so we'll stuff it over in the corner, as you said. It has to be a very high priority, and in at Claris, it's been a very high priority since the first line of code was written. Was cybersecurity was top of mind, HIPAA compliance was top of mind, and part of this is within your organization, trust is part of the key. That everyone in the organization has to believe, as does the leadership, that this is important and central. So, the leadership of your company has to demonstrate the commitment and set an example to the team. And, no whining about, oh, I hate changing my password or any of this kind of stuff. No, sorry, that's just table stakes. You have to do these kinds of things. And then again, as as a founder and corporate leader, there are a bunch of other aspects that come into play that really help, not the least of which is, take a look at some of the fines that have been levied for HIPAA violations and the like, and that doesn't scare the hell out of you, and nothing will. But there are other simpler things like, we maintain cybersecurity insurance, and it's a heck of a lot easier to get cybersecurity insurance if you can say, yeah, well, we have a SOC 2 audit report here that shows that we're doing. That just takes all sorts of stuff off the table, and I don't know that it makes my insurance any cheaper, but it does help with the process, and it gives you more security around what's there. But again, the key thing is to establish trust within your organization that this is something that is important to your leadership team, and not just something you're forcing down on the the rest of the team, saying you guys have to do this, but I'm not going to be bothered myself. That will just wreck it right out of the gate.
No, I agree. And like on the like to touch a little bit on the question in the Q&A, it's it's the same whether you're using HIPAA or SOC 2 or ISO, knowing exactly what systems you use, where are the data flows, who has access. These are kind of the building blocks. We've seen like the recent breaches with large provider in the US. There was not enough information on the underlying infrastructure. So you switch off something that is a key system that the whole infrastructure depends on. You don't have network diagrams, you don't have data flows, then it makes it very difficult to keep the lights on and also protect your customers' data, which they entrust in you to with the service you provide.
Yeah, no, just to expand a
Yeah,
bit on
yeah.
HIPAA rules and compliance. The situation you'll be in as a software supplier to a hospital or somebody in the United States is that they will ask you to sign a business agency agreement, which essentially says you're going to take on the liability of protecting that hospital's information wherever you touch it. And there are certain mechanical aspects of that. And what HIPAA is wanting you to do is first, don't accidentally disclose data. That's pretty straightforward. But equally important that only authorized people have access to patient information. And if they have access to that information, there is a record kept that they accessed it and that they are authorized to look at it. So those structures have to be built into your product, and that's what you're promising your customers when you sign an agency agreement. So there's a little bit of design that has to go into it. But other than that, really you're protecting yourself against the liability of having signed a business agency agreement. So you're not, doing any more than the basics as far as your customer is concerned. But what you want to do is put up enough barriers so that they can't turn around and say, well, we had a big data breach and it was because of your software. That's the end. That's the bad outcome.
No, I agree. And I think the other aspect is as you build the infrastructure from ground up, it's taking into consideration things like data residency, where your clients' data are, and your design your system in a way where you can accommodate your clients and not get into a situation where you're not very transparent where the data is and how you operate. Something I wanted to touch on is the kind of importance of reviewing your third-party vendors and suppliers, especially in the healthcare supply chain, and how kind of you've seen over time things change with like moving to the cloud or more digital. Have things improved? Is it worse?
Yeah, well, it again, what happens is things go down the chain. So whereas I used to have to worry about keeping my server room secure and the network access to it secure and all that kind of thing, well, I don't have that anymore. I now turn that all over to Amazon, AWS or Heroku. However, it still is incumbent on me to make sure that our agreements with them ensure that they have physical site security. Now, obviously they're pretty good at that, and they can convince me that they know how to protect their servers and protect their data. But that responsibility is not abrogated. I can't simply say to my customers, well, it's Amazon. Like, sorry, I'm still responsible. So I'm responsible for ensuring that those things are being done, and that the protection, the physical and virtual protection is in place to at least the level that I would expect of my own organization. So you can't just get out from underneath it by pointing off to somebody else and saying well, that was their responsibility. Well, sorry, that's not a dodge. But in the end, if you're trying to establish, as a software developer in healthcare, you're trying to establish high levels of security, it really isn't that hard. I don't want to, make it sound like it's a super difficult thing. Quite frankly, you can get a long way along the road just by doing the simple stuff. So first, take security seriously and set an example. That's kind of step one. So within your organization, it's something that is not done off the side of your desk. It's front and center to what you're doing. Get a company password manager, set up a VPN. Do policies on respecting privacy, and make it a serious offense if you don't respect the privacy of patients' data. These are almost zero cost things that you can do to get started that actually put you in a pretty good, in a pretty good place. Um, so don't get concerned that this is super hard and really really hard to do. I mean, it's as long as you have the right attitude that it's something that's central to what you're doing, it's really not that difficult. It's not a lot more work.
Yeah, I think this is something we've seen from Cobalt when we do vendor assessments with clients. Even in 2024, there's big providers where you go through an assessment, and a lot of the companies these days will have their infrastructure on AWS or Azure, and you ask for an attestation, and they send you AWS's attestation, which is a very big red flag that they don't realize the shared responsibility model, and they think AWS is covering everything. And I was kind of have this discussion with management that I know it makes sense. You have this provider part of your solution, but it's always a good plan to review this as a risk and see how you can mitigate this by having alternatives and seeing how you can, as you said, Jeff, protect your customers' data, because everybody's following somebody else in the industry, and it's not always the best decision making to just follow logos on a website and say, this is used by another 10 big companies. And also, always, as you said, do your due diligence and yeah, make sure you're happy with your vendors.
Yeah. So, I mentioned a couple of times keeping this, the whole cybersecurity is front and center in terms of the team, and it may sound like I'm talking just about the dev team, but of course it's more than that. It's the whole company. It's everybody involved. Because your customer support people, they may be talking directly to end users. They may be having to dip into the database and figure out what's going on. At every level, you need to be concerned about privacy and cybersecurity. And I mean, one of the biggest risks, I think, Peter, you may be able to correct me on this, but I think something like 80% of attacks, cyber attacks on companies, come through phishing emails. So unless you want your entire system locked down under a $5 million demand for ransomware, you probably want to train every single employee to recognize phishing emails and make sure they don't click on them. And I mean, one of the things we use KnowBe4, which is a service you can subscribe to, that hits every person in my company with fake phishing emails to just see how many people will click on it, and if they click, they get sent to a remedial course on recognizing phishing emails. And it's simple, it's straightforward, but it just keeps it top of mind that there are people out there trying to do this, and you need to keep an eye out. One of the interesting things that I found through that exercise, we've been doing for years now, we've been doing this ongoing testing of our staff on phishing. And one thing that has turned out to be incredibly valuable, which is kind of out of left field in a way, is that the culture of our company is such that phishing doesn't work very well. We have a very open culture. We communicate all the time. I mean, very, very regularly. And if my bookkeeper was to get an email purportedly from me saying, please transfer $5 million to somebody for some secret project, she would phone me 30 seconds later saying, basically, WTF, I didn't know anything about this. Give me the secret code word, because this sounds like a bunch of nonsense. So there is a very much an openness among everyone in our company that, hey, if it sounds the slightest bit fishy, just check it out. Don't make any assumptions. And also, really do know how each of the different, I'll call them divisions in the company, refer to themselves and talk about it. So if you get an email from HR@clarishealthcare.com, it's like, yeah, well, we don't have anybody called HR. We don't have a human resources email box. So as soon as you see that, it's phishing. It's just like it's done. So that openness and communication and the culture of, not being afraid to challenge anyone up to, including the CEO, of anything that sounds a little bit off, build that in, that if you have the slightest bit of suspicion, check it out several different ways if necessary to make sure that you're not being played.
Yeah, that's a very, very good advice, and it's something we discuss with clients, even if they don't have something to start with. Everybody gets phishing emails all day long. So something I recommend to clients is if they have Slack or Teams, have a channel that's called security instance and paste screenshots of examples when somebody gets something. So everybody in the company gets exposure, and they see different variations of social engineering, phishing emails, pretending to be the CEO, pretending to be finance. It's something that is very common is somebody joining a new company, announcing on LinkedIn, I joined Claris Health as an engineer. Within a day, they figured out if their email is first name, last name, send them a bonus scheme email for 2024, or another kind of under the radar is they'll contact HR in the company and say, I just joined. Can I be paid in another bank account, another BMO or RBC? And as you said, Jeff, that's where it's more have processes for how things get changed, authorized different amounts of transactions. So anything above over $500,000 has to go through other people to get approval. So that's the SOC 2 and frameworks and HIPAA are good, but processes, consistent processes, operationalized is what makes the difference. The other thing you touched upon, sorry, go ahead.
I was just going to say that amusingly enough, we had a great example of that just in the last week where, one of our team put together a new internal service thing, and they sent around an email with a link saying, we've got this new reporting service. Well, 6 people in the company immediately reported it as spam because he hadn't told anybody about the thing he was working on. So everyone immediately deleted it and reported to the rest of the team that this is probably phishing because I don't know what it is. And it was actually quite funny, but it was a great test of, be suspicious. And, this thing came around and we, none of us knew it was coming and no one had heard anything about it. So our immediate assumption was don't touch it, just take it out. So unfortunately, he had to send it around a second time, and at that time it worked, but it was a good example. So Peter, go ahead.
Yeah, I was going to say something you touched upon earlier, and I think you were doing very well from the beginning, is SaaS businesses will focus on the cloud infrastructure, and it's more on the back of their mind, the access points. So it's very common for small businesses and startups to have personal device initially, their own phones, their own laptops. But there comes a point where you have to decide if you want to have that risk, because there's distributed teams across the world with personal devices accessing company resources. There's no endpoint protection. There's no encryption on the device, and it's that decision point where do you provide devices that your employees can use and perform their their job function, or you're going to keep doing this where it's there could be any point where systems are compromised because they don't realize your Google Workspace ID is something that somebody can use to reset passwords, access GitHub, AWS, and if that's on a device you don't even have visibility, or you don't monitor your activity on the accounts, how many devices an account has signed in, for example, this is going to go back to the basics and make sure you have visibility of what device you have, what accounts you have, if things are not used anymore, being disabled on time, and this is the thing you're on top of, like access reviews, making sure where people join are given appropriate access, when the leave access is disabled on time. And this is, unfortunately, even today, those processes are what hurt a lot of companies. There's accounts left active for 2 years because somebody needs to access the mailbox from management. They haven't figured out a process to do this securely. Yeah, so I think that's a very important aspect of any information security program.
Okay. Yeah, I would say that in work with Cobalt to go after our SOC 2 accreditation, it was a nice surprise actually in a lot of ways. Well, two aspects to it. I mean, I didn't know what SOC 2 was until we started the process and start reading through all the requirements, and there's pages and pages of stuff, and your immediate reaction is, oh God, a bunch of bureaucratic nonsense. But when you actually look at it, I would challenge anyone to look at something and saying, oh, there's no point in doing this. This is all stuff that you should probably be doing anyway, and you probably are doing anyway. You may not be documenting it as well as you should, or checking that it's up to date as often as you should. But very much like when you're asked by FDA to submit a whole pile of documentation, for FDA clearance of a medical device, there's nothing in there that they're asking for that a reasonable person wouldn't do. All they're wanting you to do is write it down and then, say what you're going to do and then do what you said. But, essentially that's all that SOC 2 is doing, is saying, there's nothing in it that is an unnecessary waste of time. I can say quite definitely there's nothing in it that's an unnecessary waste of time. It's simply asking you to be rigorous about making decisions about what you're going to do, and then making sure that you do those things you said you were going to do, and keeping a record of that. So I was really quite delighted to find out that our dev team had pretty much done everything already. I think Peter, you'll back me up on that. It was just sort of ticking the box and saying, yeah, here it is, here it is, here it is. We've done all this kind of stuff, and it's not like it was a whole bunch of new work needing to be layered on. It was more a question of organizing things properly and making a commitment to keeping them refreshed and not just putting them in a file and forgetting about them. So I don't know whether that's your experience with other companies too, Peter, or not.
Yeah, this is getting more difficult, like since last couple of years. And as you said, yeah, Clarus Health had like a very good software development lifecycle. You're following OWASP as part of your development lifecycle. You're reviewing vulnerabilities, static, dynamic code analysis, and yeah, right now it's a bit all over the place. We had, since ChatGPT came out, a lot of companies are using LLMs, incorporating them into production workflows without doing proper risk assessment. And this is where you end up, management doesn't have visibility that development is either using AI tools to write code. So essentially they're sending all the intellectual property into and a vendor that they haven't risk assessed, or there's a lot of customer data leaving the business and going into other systems to be transcribed, analyzed, summarized. And then there's eventually there's a breach or something with that supplier, and you cannot answer to your clients if you lost any of the data, how much data has gone out the window. And it's a very difficult spot. And as you said, the thing you had, like when we were reviewing software development, that was you had a very mature process in place, and it's very difficult working with developers. They're always want to use the latest and greatest and shiny tools, and having the maturity as a company to risk assess these things properly and make an informed decision is what helps you from getting breached. And it's not just about compliance, it's like getting a green check. It's keeping your customers' data secure.
Well, if there's any one thing about cybersecurity that keeps me awake at night, it's the guys on the other side of the fence, the black hats. using the AI tools to attack me. And that I think is something that we have to be increasingly aware of. It's actually quite terrifying to me, not only for the perspective of Claris as a company, but Claris's end users who are seniors in their own homes being called up with voice synthesizers that imitate their grandchildren. And then now we're seeing cases where there's actually completely faked videos of people, all based on stuff you can easily pull off. You can go on the web and find pictures of me and movies of me and my voice, and you could clone me quite easily and have me call up our, maybe I shouldn't be suggesting this, call up our chief financial officer and say, transfer $5 million over into this account, and it's like, well, I can see you and you're speaking to me in your voice. These kind of attacks they're coming. I mean, like it or not, they're coming. And we've actually put security processes in place in Claris, specifically with that in mind, that even if you get a video call from me asking you to do something, there are certain questions you ask me that only I, the real physical person, can answer. And so you ask those questions, and we change that regularly as well. So you're not going to find that out. But on our end users point, place, how are we going to deal with more and more sophisticated attacks driven by AI? And I've actually been taking, obviously, as everyone has, been taking a lot of interest in AI lately, and I'm very much in line with, I think it's Bill Gates's comment that, at first everyone overestimates in the short term, the impact of these things, but they grossly underestimate the impact in the longer term. And right now, as one of the CEOs of an Israeli AI company came out and said last week, uh, large language models are essentially autocorrect on steroids. I mean, that all they're doing is putting words together in a common pattern. So, we're maybe a little overhyped as to what it's doing. However, the largest large language models right now have 1.7 trillion parameters. And just to put that in perspective, in the equivalent in the human brain is 100 trillion parameters. Okay, so, well, we're, only uh, 98% of the human brain. But that's this year. Next year, it'll double and double and double again. And, we are going to move quite rapidly from autocorrect on steroids to artificial general intelligence. And we have no idea what that's going to mean from an attack profile from cybersecurity. And uh, if there's anything keeping me awake at night on the whole cybersecurity thing, it's how are people going to use this to attack me, attack my company, and attack my clients? And, it's something we definitely need to work on.
I think even with like AI and any advances, we always kind of go back to the basics, having enough understanding of your environment, having map data flows, having alerting and controls in place. So it's not possible somebody to do a data dump of a whole database without getting authorization or getting alerting or having both visibility and like restrictions in place. And the other way is not to kind of be scared of these things. And we have to have discussions with clients where there's a genuine business case to use some of these LLMs, but it's not the very first thing you find online that's free or everybody's using. There's things you can put within your network or locally that you can leverage and support different business functions. But at the same time, going back to security awareness training and understanding the risks, we don't put customers' data or trying to solve a problem by offloading it to another thing we don't have control. And it's part of security awareness training, privacy training. We have to kind of help employees and companies to make this connection that this does something, but we have to give it data. It's our data, client data. It's not something we do like without thinking. It's it's something we have to like take a step back and think what are we actually doing.
So, what other trends are you seeing in cyber threats for healthcare, Peter? I mean, is there any other things? I mean, obviously, large language models and AI are a new attack surface, I'll say. But what else are you seeing out there?
I think the example you gave earlier about like voice synthesizer and videos, like yesterday I saw something like from a photo you can generate video and have synchronized movement, and it looks very real. There was an incident last month. There was a big transaction company did over Zoom, and the people on the Zoom on the other end were not the real people. So I think they wired $25 million without like based on what they were seeing on Zoom, which is yeah, I know why do like such a big transaction over Zoom? Like I would meet in person for something like that.
Yeah.
But as you said, having some things that are not publicly available, like what you said, protecting your clients with questions that any AI model cannot answer, or it's not something we know. It's having, yeah, adding those additional steps where it makes sense to protect your employees, protect your clients. Because at the moment, yes, anything and everything can be fabricated. So we have to have validation mechanisms.
So, is phishing still the biggest threat to a company in healthcare, or what other attacks are there on healthcare data that you're aware of?
I think like phishing combined with social engineering is still like quite prevalent, and it's going to keep continuing because we have to have some like implicit trust in people, and if we don't have like people in cybersecurity and IT get to see things all day, but if somebody in HR or another department where they don't they're not in that mindset, they don't understand that there's people actively using these tools against them, and that's where training comes in. The most difficult positions is human resources that receive a lot of CVs. CVs have malware. If you're pretending you're applying for a job, that's what they're supposed to do, review CV. So just by opening some documents you don't have endpoint protection is enough to do a lot of damage. Yeah, so I think it goes back to training, and because criminals, whether it's health data or anything else, they'll use information defined publicly. So open source intelligence is always going to be a thing. People post too much stuff on LinkedIn, Twitter, social media. So it's just spending half an hour, you can yell information about somebody working in a certain position and use that information against them. And yeah, it depends on how much they're going to go after your business, and if there's something of value or they can gain from like compromising your
But that's the
systems. So
tension, isn't it?
yeah,
Because on
yeah.
one level, we use LinkedIn to promote what we're doing, and
Mhm.
so a lot of activity in that space that is part of our marketing strategy. So, you need to balance the risks
Mhm.
and the benefit of that. Even doing presentations like this is being recorded, and it
Mhm.
presumes
Mhm.
to be accessible to people. And now you know what my office looks like, and
Yes.
uh, but it is a balancing act, and I think you sort of have to look at each one of these things and make a conscious decision about the risk versus the benefit of participating in social platforms and keeping your name out there. And it's getting to be a difficult decision sometimes. I mean, there are certain platforms that I simply will not use. I've
Mhm.
got a limited number of platforms that I use, and I feel like the benefit is more than the risk for those ones, but others I'm not so sure. So, yeah. In other words, you won't find me on Twitter/X or whatever it is today. So, uh,
I think it's like there's some power with the health system. So you go to a physician, you expect them to explain all the scenarios, and you get to make informed consent of what you want to do. And I think cybersecurity is like should work in that fashion, and that should be the function of the company. Educate management staff. Like we're using the systems, like whether it's social media or something else. There's a potential that we gonna receive phishing emails or those kinds of attacks based on that, and be aware and prepared. Shouldn't scare people and stop them from doing things. But
Well, I
uh,
guess the
training,
only
yes.
comment I'll make about that is that, I think for a lot of smaller organizations or, startups that are just getting going, there might be a bit of a feeling that, well, we're so small and insignificant that,
Mhm.
it's going to find us. Well, the truth of the matter is, if you look at the statistics for the number of attacks that are out there, these guys just attack everything, everywhere, all the time. Doesn't matter how big or small you are, they're going to try and take a shot at you. Uh, because they don't know how big or small you are. I mean, they just don't care. They're
Yeah.
just scattershotting everything. So even though you're two guys in a garage and you have 50 cents in revenue, they're still going to go after you. So that's not that is not a solution or a response, is to say, well, we'll just be small. That doesn't work. So it's important to actually assume that these useless creatures are going to be attacking you, and put yourself in the frame of mind that those attacks are going to come. So what are you going to do about it? And how will you respond? How will you stop them from being successful in every way you can? That's the only thing you can do. So,
Yeah, that's a very good point, and it's something that a lot of companies miss, or I said they're in that mindset like we're too small. Who knows about us? The thing that it's not they don't understand is the minute you put something online, whether it's AWS server or your own server in your garage, and it's publicly accessible within 10 seconds, somebody from anywhere in the world is pinging that box, trying to do reconnaissance, figure out what version of system you're running, if there's an exploits available. So within half an hour, might already compromise the box. And it's one object could be to get data. There might be something valuable in there, payment information, health information, personal information. If there's nothing like that, they can still use that to host malware, to attack other companies. So immediately your reputation is shot, basically, because it looks like your company is spreading malware. And there's various scenarios that can like leverage your infrastructure to do other harm. So yeah, as I said, Jeff, this is not like we're 2 people, 5 people, 10 people. They don't care. It's an IP address that's public on the web, that's just there for them to do whatever they have in mind. Um, it's not necessarily going by company name or company directory. It's more like a device online. Yeah.
I mean, some devastating cyber attacks have been launched by kids who are just playing. It is
Mhm.
It's kind of cool. Let's see how many systems I can get my fingers into, and they're not necessarily trying to take you to the cleaners and steal all your money. They're just mucking around, but even so, it still creates massive amounts of damage and problems. So just as Peter just said, assume that as soon as you put any of your services up on the web, it's going to be attacked within 30 seconds, or less. So assume that that's going to happen. Now, how are you going to protect yourself? You can't assume you're going to keep your head down and no one's going to find you. So,
So something I just remember what you mentioned, right, FDA earlier. I know, like over the years, it has been very difficult to get through FDA to approve a device. So by the time they get approvals, there's security vulnerabilities and gaps already. Is this still the case with like devices? If you have a device element to your like solution?
yeah, FDA is one of those interesting things. To be honest, I feel very sorry for FDA because they're damned if they do and damned if they don't.
Mhm.
So If they're quick and responsive and get a product out on the market really fast, well, inevitably somebody's going to have a problem, and then they're going to turn around and say, how did you ever let this on the market without realizing that for left-handed blue-eyed people wearing glasses,
Mm.
problem. So do it quickly, you're in trouble. On the other hand, if they take their time and work through it all carefully and make you do lots of clinical trials, everyone says, why are you keeping this life-saving technology away from my grandmother?
Mhm.
They
Mhm.
can't win. So I've always found that if you approach the FDA with, okay, guys, you're in an impossible situation. Let's see if we can negotiate a way through this where we both, get what we need with a minimum amount of work and pain. FDA is not the enemy. I mean, they're
Mhm.
they're they're trying to do a really, really difficult job. And if you understand that they're not your enemy, they simply have rules that they have to follow. And if you help them go through that, they'll be cooperative. I mean, one of my favorite stories is I had a product once that I was pretty convinced was a medical device, and I went through what's called a 513G pre-approval to confirm the classification for the device. And I got a phone call from the FDA person, and she said, "Did you really mean to say this, or did you want to say that?" And I said, "Well, I could say that." Well, like, where are you going with that? She said, "Well, if you say that, it's not a medical device, and my job is done." I was like,
Mhm.
"Oh, how interesting!" So I mean, they really are trying to make the whole process simpler for themselves and for you. But it's not easy. I mean, there are a number of things FDA requires you to do, and you have to do them. So
It's an interesting conundrum where you have on one side something like the banking industry where there's a lot of infrastructure still working off like a COBOL program language, and there's nobody knows how to maintain this. And then you have like on the medical side, you have things that take so long to get approved that you have pacemaker in patients where somebody can remotely stop it because it has some Bluetooth or some way to communicate. And it's we're kind of moving away from on-prem and maintaining things, but there's still elements where there's dependencies, and you said you have to find a balanced approach. You can just increase security, but at the same time make it unusable. So it's very difficult always finding that balance.
yeah. Well, and that's writ large in our space. Once again, what Claris does is provide a platform for communication care for older seniors. And one of the objectives is to remove the necessity for, somebody who's 88 years old to remember a 16-digit password that changes every 3 months. And simply not going to happen. And sometimes designing this, fairly standard security features into software make it completely unusable for your target audience. Well,
Mhm.
I like to think that's a design challenge, which, we think we've overcome, but it really is. You sometimes just can't take the simple thing and say, well, we'll make the passwords more complicated. Or for example, it's sometimes extremely difficult to balance the need for security against the need for usability. And, as Richard Branson likes to say, any fool can make something complicated. It's really hard work and insight to make something simple, and it is. So,
All right.
Okay.
Thank you, Jeff and Pete. I think we are almost up to time. I'll see if we should take in some of the questions. I think thank you so much for all these insights. I certainly enjoyed the session very much. Let me take a look if we do have any questions. I think it's still the HIPAA compliance questions. We may have like talk about it a little bit, but I'll see if the two of you have anything to add. What are your tips and guidance for organizations? Like they're like early startup, 1 to 2 people stop trying to get started with compliance and maybe like considering HIPAA. What are your tips and guidance for them?
well, I think I summarized it earlier that, all HIP is asking you to do is make sure that there's not accidental disclosure of personally identifiable health information, and that you track that anyone accessing the information has authorization to do it. And that means they have a username and password and they've been vetted before they can get to your system, and that you keep track of the fact that they have looked at something. So you need to design that into whatever you're doing. Beyond that, Really, you just want to make sure you protected yourself against accidental disclosure through a cyber breach or something else. And again, that's table stakes these days. Anything you're designing, you have to do that. So I hope that answers your question.
Thank you, Jeff.
No, also to add to that, it's um, taking care of the business side of things and processes is key. Like these days, anyone within a week can spin up something in AWS with Lambda functions and use frameworks to build a front end and start taking customers in, registering, like adding all kinds of data and being thoughtful of, that you're somebody's entrusting their personal data, health data, uh, and as Jeff said, having that like thought through the design or where the data going, who's accessing it. You might be using contractors, consultants. Uh, it's taking kind of a step back and seeing that you're not digging a hole will be very difficult to get out, or either through fines or a breach. So taking care of the business side of things is key. It's not all technology.
Right, thank you, Pete. I actually do have a follow-up question. So for healthcare companies that are kind of early startup, small, like we talk about so many things. We talk about user education, we talk about phishing simulation, access control process. We also talk about compliance. Where would you advise them to start if they have like not done anything so far yet and cybersecurity feels so overwhelming? Like, how would you advise them? Where should they start? How should they start?
Take that one,
Yep.
Peter.
Yeah, sure. So it's confusing these days because in the old days we used to have like an office location. People would go in, you would know who could go into the office, seeing documents or access systems. Now everything is over the cloud. People are over the place. So visibility is the very first thing. You cannot protect what you don't know you have. So know who has access, what systems you have, um, how locked down they are. I would start from the perimeter, start going in, making sure you're not exposing too much information or if things are configured correctly. And then back everything with policies, procedures, processes. But yeah, I think that's from a threat landscape perspective. I would start with like the external exposure and start closing in.
Excellent. Thank you, Pete. Anything you want to add, Jeff?
No, I think that covers it well.
Thank you, thank you. Any tips for organizations looking for like achieving compliance but not so sure which standard they should pick?
Yeah, that's a good question. I mean, there are a number of different directions you can take. I think probably the first thing to do is to take a look at the frameworks for each of the standards and see which one most aligns with the way you do business. That's probably the easiest way to do it. If because there are GPRS and IEEE and all these different ones, at least start with one that is as close as possible to the way that you either do or you want to run your business. In our case, SOC 2 was obvious because when we opened up that framework, we said, well, this is frankly what we do. So it wasn't a huge stretch. So
Yeah, I think in terms of compliance, it's sometimes always like geography related. So in US and Canada, a lot of companies are more familiar with SOC 2. So they would expect a company to have pursued SOC 2. In Europe, ISO 27001 is more prevalent. And like Jeff said, GDPR, and there's different privacy frameworks and standards in every area. But starting with something where you have visibility, maybe using some elements from different standards like ISO 27001, using CIS for hardening devices configuration, and then eventually you get to a place like what Claire's Health was that it's not far off to go for SOC 2 or ISO 27001 because you have done the fundamentals and you're in a good state.
Thank you. Excellent. Thank you, Pete. This is from me. Maybe it's more for you, Jeff. How does having a recognized certification help with business or help with like talking to customers and stakeholders?
yeah, that's interesting. As you know, As our sales have gone to larger and larger organizations, the sophistication of the customers increases as well. So when we're talking to small organizations, quite often they'll say, "Oh yeah, what about cybersecurity?" And we say, "Oh, it's all good." And they say, "Fine." But when you start getting to larger organizations, government organizations and the like, quite often they have quite a bit of expertise in IT themselves. And they'll come to us and say, "Well, what standards do are you accredited to?" And they'll directly ask, for that. And as I said, my insurer is one of them, like what standard, do you have a SOC 2 audit report? Because if you do, that'll short circuit this whole insurance application rather quickly. And we now have larger customers literally asking on the standard forms you get when you do a request for proposal. There's usually a whole section on cybersecurity now. And man, it's so nice to be able to just tick that box that says SOC 2 and all the rest of it disappears. It's rather than having to go into details of all this kind of stuff. So it becomes quite valuable as your company grows and you're dealing with larger and more sophisticated customers. It becomes more and more valuable. So,
Excellent. Thank you. Right. I don't think we have any more questions. So thank you so much, Jeff and Pete. Love everything you've shared, and thanks everyone for joining us today. If you'd like to learn more about how Kobo can support you, feel free to send us an email. Every month we host free webinar and fireside chat. We talk about AI a little bit today. Next month, actually, we will dive a little deeper into AI, and you're most welcome to join. Once again, thank you so much, the two of you, and everyone have a great rest of your day.
Thanks, Rain. Thanks, Jeff.
thanks very much. Bye now.